Early clinical development. In this point, we are going to see about 3 points. Early stage development in human, phase 1, safety studies, phase 2 studies, and finally formulation and dosage regimen. Phase 1 study. The data for seasonal allergic rhinitis, the clinical efficacy and safety of Claritin D 24 hours extended release tablets was evaluated for 2 weeks. Involved a randomized parallel group for clinical trial involving 2,852 subjects between 12 and 78 years of age with a seasonal allergic rhinitis. Among them, 708 of whom received a Claritin D 24 hours extended release tablet. And in trial 2, subjects were randomized to receive a Claritin D 24 hours extended release tablets once daily, and the Claritin tablets 10 mg once daily, or Claritin D 24 hours sustained release pseudoephedrine 240 mg once daily for 2 weeks. The majority of the patients was between 18 and 65 years with mean age of 34 years and were predominant women, about 63%. The patient ethnicity was 79% Caucasian, 10% Black, 8% Hispanic, and 3% Asian or other ethnicity. The total score of Claritin D 24 hours, which consisted of loratadine and pseudoephedrine, excluding nasal congestion, was significantly greater than pseudoephedrine alone or Claritin alone over 2 weeks treatment period. In early stage development in human, phase 2 studies, in dose ranging studies, a clinical trial of Claritin tablet involved over 10,700 patients from 12 years old who receive a Claritin tablets or other antihistamine or placebo in a double-blind randomized control studies. Results show that in placebo-controlled trials, 10 mg once daily of Claritin tablet was superior to placebo and similar to other antihistamines such as clemestin, which is given 10 mg twice daily, or terfenadine, which is given 60 mg twice daily, in effect of nasal and non-nasal allergic rhinitis. In studies of Claritin tablets at a dose of 2 to 4 times higher than the recommended dose of 10 mg, a dose-related increase in the incidence of somnolence was observed. So patients, particularly those with hepatic or renal impairment and elderly, are experiencing impairment clearance of loratadine and its metabolites. Also, the 2-week trial which involved 188 pediatric patients with a seasonal allergic rhinitis aged from 6 to 12 years was conducted at a dose of Claritin syrup up to 10 mg once daily, but also 60 pediatric patients aged between 2 and 5 years old was examined for Claritin syrup for 5 ml. In both cases, no unexpected adverse events were observed. Formulation and the dosage regimen. A clinical trial of Claritin ready tablet involved over 1,300 patients was received Claritin ready tablet or placebo. The results show that Claritin ready tablet was superior to placebo and similar to Claritin tablet in effect of nasal and non-nasal symptoms of seasonal allergic rhinitis. Among those patients involved in double-blind randomized control studies of Claritin tablets, about 1,000 patients aged 12 years and above were involved in studies of chronic idiopathic urticaria, and results show that in placebo-controlled clinical trials, Claritin tablets 10 mg once daily was superior to placebo in the management of idiopathic